My name is Sarah, and this is my third reflection for NUR124. And this reflection is based on an ethical case study involving a patient called Mr. Thompson, and I'll be using the Gibbs reflective cycle. So, in this scenario, I'm a first year nursing student and I'm out on placement at a residential aged care facility. And I'm working with a supervised registered nurse to care for a patient, 82-year-old man with early stage dementia called Mr. Thompson. He is generally able to communicate clearly, although he can become confused later in the day. One afternoon, Mr. Thompson was prescribed a new medication to reduce agitation. However, he refused to take it and said that he did not want any more pills because they made him feel unlike himself. Soon after, his daughter arrived, and she insisted the medication should be given and said that her father no longer knew what was the best for him. And she also threatened to make a formal complaint, and the registered nurse told me to give the medicine, and it would just make the shift easier and help keep everyone safe. The key facts were Mr. Thompson's refusal, his daughter's insistence, and the registered nurse's decisions to prepare the medication despite his refusal. Before the situation, I knew patient consent was an important part of nursing practice. However, I was unsure how decision-making capacity applies to a person with dementia. I also assumed family members would usually know what was the best because they know him the best. My feelings or my reaction when I first heard or read about this scenario was I just felt a bit torn. I felt sad for Mr. Thompson, and I felt like his decision should be respected because it's his body and his choice. However, after hearing his daughter, I started to question myself. I wondered whether she knew what was the best for him and whether the medication might help. When the RN said it would make things easier and safer, I felt uncomfortable but also uncertain. As a first-year nursing student, I questioned whether it was my place to speak up. Looking back, I realized that uncertainty could easily lead someone to stay silent when something does not feel right. So you just might end up staying silent because they have more education than you. The main ethical issue was the conflict between Mr. Thompson's right to make decisions about his own care and what others believed was in his best interest. I do not think the daughter or the nurse had bad intentions. Both seemed to believe they were helping him. However, good intentions do not always lead to the right decisions. And autonomy means respecting a person's right to make decisions about their own care. Having early stage dementia does not automatically remove their right. And Mr. Thompson clearly communicated his decision and explained why he did not want the medication. The NMBA Code of Conduct states that nurses must respect patients' rights, including the rights to refuse treatment. Giving medication to a patient who is clearly refusing treatment may cause emotional harm, or even if the medication could be beneficial. What concerned me the most was the registered nurse comment that giving the medication would make the shift easier. This suggestion was clearly based on staff convenience instead of prioritizing like patients' wishes. And when I reflect on why I doubt myself, I realized it was partially because of an assumption. I had never really questioned before. I just assumed that family members of people with dementia were automatically better placed to make decisions rather than the patient themselves. This made me question whether Mr. Thompson's wishes should care less and his daughter's concerns should be solved first. Looking back, I can see how this could result in a patient's voice being overlooked. I also need to acknowledge the influence of authority. The registered nurse was my supervising nurse and had much more experience than I did, and part of me wanted to trust her judgment and stay quiet. I also, at the same time, I saw speaking up as a challenge. I just felt like I was challenging someone way more experienced than me. However, now I understand that advocacy is a part of professional nursing practice, and the NMBA standards make it clear that the nurse nurses, including student nurses, have responsibility to advocate for patients. This experience also changed how I see my role as a nurse. While I'm still learning, I have responsibility to raise concerns when a patient's rights or dignity may be at risk. This experience taught me that ethical nursing practice is about more than knowing ethical principles. It also requires the confidence to act on them. For Mr. Thompson, receiving medication against his wishes could damage his trust and take away his rights to make decisions about his care. And for the healthcare team, regularly ignoring patients' refusals could eventually create a culture where patients' rights were not fully respected. For me, staying silent would have meant ignoring something I believed was wrong. This experience helped me understand that being a student nurse involves developing the confidence to advocate for patients, not just learning clinical skills. Going forward, I have three commitments as a student nurse. First, I will not assume that a diagnosis of dementia or any other sickness automatically means a person cannot make decisions for themselves. Instead, I will focus on individual and what they say and if they can actually decide for themselves. And secondly, if something feels ethically wrong during placements, I will speak up appropriately. For example, I could simply just ask, can we just check the procedure when a patient refuses medication? I would just discuss the issue with my clinical facilitator or another appropriate staff member. Third, I will continue to reflect on my own assumptions, especially those related to dementia, decision-making capacity, and authority. Developing the habit of reflecting can help me become a better nurse and more ethical, and I can use more patient-centered care in my nursing future. Thanks for listening. Thank you.